may not want to think about this just yet, but now is the time to get your child back into that bedtime routine before school starts. Dr. Jen Arnold and Dr. Louis Ortiz from Johns Hopkins All Children's Hospital join us to discuss how to spot sleep problems, when you should see a doctor, and of course some tips as we approach this point in summer when we need to switch things around. Welcome. How are you?
Great to see you.
We love when you're here, and I can't believe we're talking about the start of school already.
It's crazy, right? It's coming around the corner, and now is the time to start getting ready, because I don't know if your kids are like my kids, but the summer has led to poor sleep routines, and so I've got to get them back into like a normal routine, and the earlier I start, the better chance of success.
We were just this past weekend, we went out of town and my daughter's sleep schedule was up and she's still feeling it. So I can't even imagine the length of the summer break when they really develop those habits.
Yeah.
Where do you begin? What are some tips that people can use to kind of start thinking about bedtime routine and getting back in the swing of things?
Well, I think, first thing is to sort of start early. And start small. For us, and I think for most kids, what works really well is having that routine. So warm bath, getting them ready for bed, brushing your teeth, and then easing them into having, book time, reading time, and then lights out. And I usually recommend sort of, moving up that bedtime closer to the goal over the course of the next, month, if you can, so in little increments. So, you may, if they're going to bed at 9 and the goal is 8, start at 8:45 and then 8:30, and then work your way up. The other thing that's really important, I think, that many parents may forget about is the impact of electronics. So screens, so trying to limit them at a minimum 30 minutes before bedtime. That will help them to get back into a more calming demeanor to go to sleep. It helps to, the lights can be distracting. The other thing to think about too is caffeine and other things that might also increase their alertness. So decreasing caffeine as much as possible, especially closer to bedtime.
And these are some of the things that are good to be reminded of, and definitely good tips. But maybe you have a child that you're worried about has sleep problems. Maybe they're not getting that restful sleep. And I want to get your thoughts on this, because you said you've seen everything under the umbrella when it comes to sleep issues. When should parents pick up the phone?
So there's issues with not getting enough sleep and getting too much sleep, and sometimes they can be related to the same problem. So one common problem that I see in many patients with parents complaining that my child doesn't sleep enough or my child sleeps too much is sleep apnea. So sleep apnea, while it's not the most common disorder in children, occurs about 2 to 5% of children. It's still common enough that if your child is snoring and having problems staying asleep or falling asleep or sleeps too much, you might want to consider that, especially if your child has other issues related to this, including hyperactivity, concentration difficulties during the day, or even other things that you may not think about, like increased headaches. Sleep apnea and disrupted sleep can have multiple connections with health, and so I have patients that may complain of something that may not seem directly related to sleep, but once we correct that sleep disorder, the problems get better, if not resolve.
Well, and I know a lot of this happens at the sleep center that you do have, and I know that's also dear to you. This hits home for you, right?
Yes, absolutely. Both Will and Zoe have achondroplasia, which is a type of skeletal dysplasia that puts them at risk for sleep apnea. And so we knew from the moment that we brought Will home, actually, that he likely had it. I remember that first night in China in a hotel, my husband and I watching Will fall asleep, and he was working hard to breathe. He was even turning blue, snoring very loud. He clearly had severe sleep apnea. I remember my husband saying, "Oh, is he going to be okay tonight?" And I told him, I said, he's lived like this for 3 years. I don't think tonight's going to be that night that something bad happens, but we have to get him in for a sleep study. And now he wears CPAP to help him breathe at night, and he's like 95% compliant. He's just so good at it because he appreciates how much better he feels because he's sleeping better at night.
And we were talking about, too, when a child does get a diagnosis, sometimes they're able to age out of it. Sometimes it's not the case, but it's best just to call, right?
Just to call, get things started. It may not be sleep apnea. It may be something a little bit more simpler, like maybe behavioral resistance to go to sleep, which is a very common and normal behavior that younger children do. Sometimes it's just education about why it's important to go to sleep, especially with teenagers. If they don't understand why it's important. They think that, you know, the freedom is more important than their health. And then once you put things in context and how their lives can get better when they sleep enough, they usually start to get on board. At least they start to try.
Well, you know what? There's still so many things that I'm thinking of in my head. You both got to come back because I know there's more we can talk about. We are out of time now, but thank you so much.
Oh, thank you.
Thank you.
And good luck getting those little ones to go to sleep, right? Thank you again.